More than 700 National Health Service nurses in the UK are being investigated in an alleged quote-unquote industrial-scale qualifications fraud. Former head of the Royal College of Nursing, Peter Carter, has called the fraud a safety risk for the patients. The scandal revolves around specialists or proxies impersonating as nurses in Nigeria in a crucial test required for UK registration. Carter has emphasised the concern, claiming that due to the practice, NHS ends up with incompetent nurses. He further said, and allow me to quote here, "It's very, very worrying if there are organisations that are involving themselves in fraudulent activities, enabling nurses to bypass these tests." On the other hand, Carter also praised the Nursing and Midwifery Council, or the NMC, for their swift action. He commended their efforts to protect care quality and patient safety. 48 nurses working in the NHS are currently under scrutiny. However, the NMC is unable to revoke their admission, but it is continuously urging them to retake the test. A second batch of 669 Nigerian health staff, mostly nurses, is also facing allegations of fraud in their test results. The NMC has rejected most applications due to serious concerns about honesty and trustworthiness. Officials have even said this is the largest fraud the organisation has ever encountered. Now, the NMC has suspended over 40 global test centres. This is a part of a robust measure to ensure patient safety and register integrity. The UK's Department of Health and Social Care supports the NMC's fraud investigations, emphasising the need to safeguard the integrity of the process. Well, for more on this, we're joined by our correspondent Stuart Smith from London. And Stuart, the NHS rarely out of the news at the moment, and some more concerning news regarding this potential fraud. Give us your assessment.
Yeah, the Nursing and Midwifery Council says that while there are 48 nurses it believes fraudulently obtained these passes on these test results, there are around 600 others that it also believes have done so but haven't yet made it onto the nurses registrar. They're working in healthcare, for example, but not as nurses. But it's those 48 that are of most concern. These are the people qualified to work in hospitals around the UK, connecting intravenous strips, for example, responding to heart attacks, and also responsible to a large degree for patient care. There are also around 1,200 others that the NMC says it can't prove that test results were fraudulently obtained, but they believe that those tests are invalid and would like all of them to take those tests again to prove that they were the ones who did take the test in person in this one city in Nigeria. With this test centre is believed to have used proxies in order to help people get the results they needed. That was detected by the NMC by the record scores and the record time taken to pass these tests. Very fast, implying that someone far more experienced, perhaps someone more knowledgeable, or someone that had taken this test many times before was actually responsible for producing the results. Now, the union here in the UK related to nurses says that everyone potentially affected by this should be given the opportunity to take that test again to prove that they do have the necessary numerical and clinical knowledge to continue working, because those that don't could end up, and their families, being deported back to Nigeria, even those that potentially did take the test themselves but have been caught up in this scandal at a time when the UK is already seriously short of nurses.
Yeah, concerning situation. Stuart Smith joining us from London. Many thanks.